Hey everyone, welcome back to ShockDoc Medical. This is Dr. Rod, and today we're getting into some seriously important stuff. Have you ever wondered how a simple skin exam can be a game changer for early cancer detection? Yeah, we're talking about skin tumors, the signs of chronic sun damage, and how as doctors, and even as patients, we can really make a difference by catching these issues early. All right, so let's dive right in. When you're out there examining patients, one of the most critical things you can do is take a good, hard look at the skin. And I'm not just talking about the parts patients can see in the mirror. Their backs, for example, which they rarely check. Remember, the skin is the largest organ in the body, and it can tell us a lot about a person's overall health. Now, if you're a doctor, or even if you're just curious about your own health, here's a quick primer on what to look for. When you're examining the skin, first things first, check everywhere. Make sure you examine all parts of the body, especially those hard-to-see areas like the back. And while you're at it, record the patient's skin coloring or phototype. This is super important because the risk for sun damage and even skin cancer is higher in folks with fair skin, blue eyes, and blonde or red hair. I always tell my residents, if you don't check the back, you might as well be reading a mystery novel where the clues are all hidden. Also, look out for signs of chronic sun damage, something we call photoaging. Think coarse wrinkles, blotchy pigmentation, and just that overall look of skin that's been cooked too often in the sun. And trust me, if you're a beach bum, that's the message you need to hear. All right, let's get into the nitty-gritty of skin tumors. When you're examining your patient, take an interest in every bump you see. Not every little bump is a cause for alarm. Many are benign, but you have to know the difference. This is where your clinical detective skills come into play. Ask yourself some key questions when you come across a tumor. Where did it arise? Is it coming from the epidermis, the dermis, or even deeper? What types of cells might be involved? Keratinocytes, melanocytes, vascular cells, fibroblasts, neural elements, lipocytes, or something else entirely? And critically, is it likely to be benign or malignant? Could it even be a metastasis from somewhere else? Now, for pigmented tumors, I can't stress enough the value of a systematic approach. Use the ABCDE criteria. Yeah, that's asymmetry, border irregularity, color variation, diameter, and evolution of the lesion. This isn't just academic, it's a lifesaver. It helps you decide if that odd-looking mole is just an ugly duckling or something more sinister. Look at the tumor's color. Does it appear brown, purple, or is it erythematous, or maybe even a mix of these? Check its maximal dimensions and whether the outline is regular or irregular. Is the surface smooth and shiny, like you'd see in a pearly nodular basal cell carcinoma, or is it crusted, keratotic, or ulcerated? Other tips? Look for a punctum. That little central dot can be seen in epidermoid cysts or in tumors centered on hair follicles, like sebaceous hyperplasia. And if you see telangiectasia, those little red thread-like blood vessels running over the surface, that's a red flag for basal cell carcinoma. Now, here's a neat trick. Stretch the skin over the tumor between your thumb and index finger. This can accentuate that pearly appearance and clearly define the borders, especially in nodular or superficial BCCs. And don't forget to examine the edge. Is it rolled, undermined, or indurated? Ask yourself, could it be vascular? Can you compress it? Or maybe it's cystic. Does it transilluminate? And always palpate the tumor to check its consistency, whether it's soft, firm, or hard, and assess its depth. One more fun test, the buttonhole sign. Pinch the skin gently on each side of the tumor. If it sinks down like a button in a shirt, you might be looking at a dermatofibroma. And of course, if there's any suspicion of malignancy, don't skip checking the regional lymph nodes. Now let's talk about chronic sun damage, photoaging. If you see skin that looks like it's been through years of sunbathing without protection, that's a major clue. And it's not just about wrinkles. UV radiation is responsible for many of the signs we associate with old skin, like coarse wrinkles and blotchy abnormal pigmentation. In fact, sun-damaged skin literally looks old. And hey, if you're trying to convince your friends to ditch the tanning beds or stop cooking themselves on the beach, nothing hits harder than showing them how their skin is aging. Let's break down the classic signs of chronic sun damage, which you should keep in mind when you're on exam duty. Solar lentigines. These are the persistent, flat, brown spots, often called liver spots, that you commonly see on the backs of the hands, forearms, and face. Easy bruising, senile purpura. After bruising, you might notice white stellate pseudoscars, especially on the forearms and backs of the hands. This happens because the elastic tissue in the skin, damaged by the sun, can't support those tiny blood vessels. Solar elastosis. Think of waxy, coarse, yellowish skin on the forehead, temples, cheeks, and back of the neck, often with deep furrows. Sebaceous hyperplasia. These are small, yellowish papules on the face. They're often mistaken for basal cell carcinoma, but they usually lack that marked telangiectasia. Just look for a central punctum. Favre-Raccouchot syndrome. You might see thick, yellowish plaques studded with comedones, basically blackheads, on the back of the neck and face, particularly around the eyes. Telangiectasia. These are dilated blood vessels on the sides of the neck and cheeks, often with a reddish-brown pigmentation, a condition known as poikiloderma of Savate, and it's most common in women with fair skin. Hypopigmented macules. You might notice areas of lighter skin alternating with areas of increased pigmentation, especially on the forearms and bald scalp. Dry skin. And of course, dry skin is a giveaway of chronic sun exposure. Solar keratosis. These appear as rough, hyperkeratotic areas, either erythematous or pigmented, on skin that's been repeatedly exposed to the sun, like the bald scalp, face, or dorsum of the hands. Bowen disease, SCC in situ. Look for scaly red patches on the lower legs. These are usually asymptomatic, but they can be easily mistaken for eczema or tinea. And, of course, the big ones. Skin cancers, such as basal cell carcinoma, BCC, squamous cell carcinoma, SCC, and malignant melanoma. So why does all this matter? For doctors, being thorough in your skin examinations can literally mean the difference between early detection and a misdiagnosis. Early detection of skin cancer is key because when caught early, these cancers are often curable. I always say, never be shy about asking for a second opinion. If you're ever in doubt about what you're seeing, check it out with a colleague. And for patients, don't hesitate to get a checkup if you notice something unusual. Document everything accurately: size, color, texture, and any peculiar features of a tumor. That way, if you ever need a referral or a second opinion, you're armed with all the essential details. And for those dealing with sun damage, remember, prevention is always better than cure. Use sunscreen, wear protective clothing, and avoid peak sun hours. I know it's easier said than done when the beach is calling your name, but trust me, your future self will thank you. All right, folks, let's sum it all up. We've talked about the importance of a meticulous skin exam, from checking every nook and cranny to using systematic approaches like the ABCDE criteria for pigmented tumors. We've covered how to assess a tumor's origin, its physical characteristics, and even the significance of that little buttonhole sign. And we've gone over the classic signs of chronic sun damage, which are a real wake-up call for anyone who's ever spent too much time in the sun without proper protection. This episode isn't just for us doctors out there. It's for anyone who wants to understand the power of early detection in preventing skin cancer. Remember, skin cancer is the most common malignancy out there, but early diagnosis can be a lifesaver. So whether you're a healthcare professional looking to sharpen your clinical skills or a patient who wants to be proactive about your health, this information is gold. If you found this episode helpful, please do me a favor. Hit that like button, subscribe to ShockDoc Medical, and join the conversation in the comments. I'd love to hear your thoughts and experiences with skin examinations or any questions you might have about identifying suspicious lesions. Next week, we're going to explore another groundbreaking topic that could completely reshape how we approach medical diagnostics. Trust me, you won't want to miss it. Thanks for tuning in to ShockDoc Medical. I'm Dr. Rod, reminding you to stay curious, stay informed, and always take a moment to really look at the details. Until next time, take care of yourselves and each other.